what are the different kinds of rhinoplasty and the different kinds of surgeon doing rhinoplasty. So first, there are different kinds of rhinoplasty. The most common one that you will see is the simple rhinoplasty. The simple rhinoplasty is just usually done under local anesthesia, meaning there's no need for sedation, there's no need for general anesthesia. Some even do it without an anesthesiologist on the side. So it is just a fairly simple procedure, usually done by cosmetic and aesthetic surgeons, and it is just a procedure that can be done in 15 to 30 minutes, maximum of an hour, and it is what they call as just a parlor kind of rhinoplasty, the one that you can just come like getting a manicure or pedicure, and then you can come out with a brand new nose. And it's usually done by making an incision inside, but not in here in the middle, and then the implant is placed in here. So it's mostly silicone, or it can be Gore-Tex, so it will provide a bridge. So there are people with just minimal need for rhinoplasty, not the whole set, and just providing the bridge is already good enough, and that is why that can be effective. But more often when it comes to Filipino and Asian noses, the one with small nose and short nose, then those might need more complex kind of procedure. So usually we get ear cartilage, we get this one. So our ear will have this concha, and this is the Simba concha, and this is the cavum concha. So usually we get these one because these cartilage will be used into providing the tip. So as for me, I will need this one because it will provide a tip here to elongate and to project the tip. And also for those with large or bulbous tip, some defatting may be needed. So some fats might need to be removed, just like my nose that needs to be removed in some parts of the fats here. And also when it comes to ala, like the wing, mine is quite big, it has excess skin, so excess soft tissue, so an alar based surgery might also be needed, plus a sail incision on the inside. A sail incision is a special kind of incision that is actually by my surgeon, Dr. Edward Yap. So speaking of surgeons, there are different kinds, but before we proceed to that, the last kind of rhinoplasty is the most extensive one. It is the structural and functional rhinoplasty. This is where we open up everything. So we open from here and then we elevate the soft tissue, to which I will show you my own surgery where it will be done. And that is when we dissect, and then the septum or the cartilage in the middle, we remove a part of that and we will reconstruct it and put it a little forward so that it will have a tip support, because a natural nose will have a rigid upper part, rigid dorsum, but supposedly the tip should be mobile. So that is the ideal nose, that is the natural nose to which the reconstructive, structural, and functional rhinoplasty is aiming for. And most importantly, not just how it looks, but the function. No rhinoplasty should lead into obstruction when it comes to nasal airway. So as a surgeon, we are not just concerned of how it looks on the outside, but most importantly, how it is being structured on the inside. So for the types of rhinoplasty surgeons, there are three major types. So the first one would be the cosmetic aesthetic plastic surgeons. So these are general practitioners, and some have surgical backgrounds like OB-GYN, like orthopedic, and they studied again and learned about plastics and cosmetic surgery, where they usually do rhinoplasty, especially the simple rhinoplasty, the most commonly done one, especially the use of silicone or the Gore-Tex kind of rhinoplasty, and less on opening up the septum all the way for reconstruction. So cosmetic aesthetic plastic surgeons also have training in other parts of the body, so they can also do breast augmentation, breast reduction, liposuction, and even some skin related procedures, even Botox and fillers. So those are the trained cosmetic and aesthetic surgeons. So the second type of rhinoplasty surgeons are the GS plastics. So GS meaning general surgeries. So these are general surgeons who subspecialize in plastic surgery. So they don't just do rhinoplasty, they also do other types of major surgeries, especially in the body. And for the last kind of plastic surgeon doing rhinoplasty, that is where I will fall. and those are ENT facial plastic surgery. So we are trained as ENTs, underwent training of 4 to 5 years of residency training of the head and neck, including thyroid, the sinuses, the ones in our throat, tongue, ears, but we subspecialized in facial aesthetic surgery. Among us, there are also those who specialize not just in aesthetic facial plastics, but also do reconstructive. So for pathology cases like burns and other congenital malformations, they also do reconstructions. And for us, we focus mostly on facial aesthetic surgery. So we do surgery for aesthetic purposes mostly. But since we are ENT by core, our training is about the ears, nose, and throat. So we always emphasize on the function, on the functional side of the surgery. So aside from those people who just want to improve their nose, those people who have septal deviation, those who cannot breathe on one side, those with crooked nose, like the one who've had trauma, those are also the kind of rhinoplasty surgery that we do. It's not just for aesthetics, but it's also for function and repair and reconstruction all the way down. So that is why, expected as a bias, I will have my surgery done by my own mentor, and I'm so blessed to have 4 mentors, and it will be done by our founder of the facial aesthetic core of ENT surgeons in the Philippines, Dr. Edward Yap. He's like the father of rhinoplasty here in the Philippines for ENT facial plastic surgery. So remember that not all nose will have similar outcomes. Your surgeon will do what is suited for you, what is best for your facial profile, and what can be done based on your current nose. So even if you have a peg, like you have a look that you want to achieve, know that there can be limitation depending on what nose you have to begin with. And each nose will have a different outcome, even if it's done by the same surgeon, because to begin with, we are not the same. This kind of skin, the thickness of our soft tissue, the one that's inside our nose, and your current state of healing can also be a factor. Just trust that your surgeon will do his best in order to provide you with the best possible nose that you can probably have. So I trust that my surgeon, my mentor, will do his best. And I know that whatever the outcome is, it is already what can be the best that can be done with me. So thank you so much. That ends our pre-operative rhinoplasty blog. I am your ENT facial plastic surgeon, Dr. Josephine Grace Rojo, also known as the Diet Doctora. And if I am a plastic surgeon, but I'm going to be a patient that will undergo plastic surgery myself. Thank you, and I'll see you in our next video. Bye!